This combination product is used to temporarily treat cough, fever, and other symptoms that are caused by the common cold, flu, or other breathing illnesses. Dextromethorphan is a cough suppressant that affects a certain part of the brain, reducing the urge to cough. Acetaminophen is a non-aspirin pain reliever and fever reducer. This product is not usually used for ongoing coughs from smoking, asthma, or other long-term breathing problems, or for coughs with a lot of mucus, unless directed by your doctor. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Robitussin cough sore throat 325 mg, 10 mg/10 ml oral liquid antitussives, it's important to follow the directions on the product package. If you're unsure about anything, make sure to consult your doctor or pharmacist. You can take this medication by mouth, usually every 4 to 6 hours as needed, or as directed by your doctor. It can be taken with food or milk if it upsets your stomach. If you're using the liquid form, make sure to measure the dose carefully using a medication measuring device or spoon. Do not use a household spoon. If you're using chewable tablets, make sure to chew each tablet thoroughly before swallowing. The dosage of this medication is based on age and weight, so be sure to check the package label to find the correct dose. It's important not to misuse this medication, as it can result in serious harm. Do not increase your dose or take it more often than directed. If you're using this medication to treat a fever, consult your doctor if the fever worsens or lasts more than 3 days. If a child has a sore throat, especially with high fever, headache, rash, or nausea/vomiting, it's important to consult a doctor promptly. If your condition lasts for more than 7 days, gets worse, you develop new symptoms, or you think you may have a serious medical problem, it's important to seek medical help right away. Some common side effects of using Robitussin cough sore throat 325 mg, 10 mg/10 ml oral liquid antitussives may include dizziness, drowsiness, nausea, or vomiting. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. However, it's important to note that if your doctor has recommended this medication for you, they have likely assessed that the benefits outweigh the risks of potential side effects. It's also worth mentioning that many people using this medication do not experience any serious side effects. While a severe allergic reaction to this drug is rare, it's crucial to seek immediate medical help if you observe any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of potential side effects, so if you notice any other effects not mentioned here, it's best to consult your doctor or pharmacist for guidance. In the case of experiencing side effects in the US, you can call your doctor for medical advice, or report the side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Acetaminophen is an ingredient in Robitussin cough sore throat 325 mg, 10 mg/10 ml oral liquid antitussives. It's important to not take more than 4,000 mg, 4 grams, of acetaminophen a day to avoid serious liver disease, especially for adults. If you have liver problems or are giving this medication to children, you should take less acetaminophen. Always ask your doctor or pharmacist how much acetaminophen is safe to take. Do not use this medication with any other drug containing acetaminophen without consulting your doctor or pharmacist first. Acetaminophen can be found in many non-prescription and prescription medications, so always check the labels on all your medicines to see if they contain acetaminophen. If you are unsure, ask your pharmacist. If you take too much acetaminophen, overdose, seek medical help immediately, even if you feel fine. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. It is also important to avoid daily alcohol use, especially when combined with acetaminophen, as it may cause liver damage. Avoid alcohol while taking this medication. Before taking Robitussin cough sore throat liquid, it's important to talk to your doctor or pharmacist if you have any allergies to Dextromethorphan or acetaminophen, or if you have any other allergies. This product may contain inactive ingredients that could cause allergic reactions. If you have breathing problems, liver disease, or if you use alcohol, it's important to consult your doctor or pharmacist before using this product. This medication may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. Avoid alcoholic beverages and talk to your doctor if you are using marijuana. Liquid products and chewable tablets may contain sugar or aspartame, and liquid products may contain alcohol. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet, it's important to talk to your doctor or pharmacist before using this medication. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. This medication may pass into breast milk, so it's important to consult your doctor before breastfeeding, even though there have been no reports of harm to nursing infants. It's important to be aware of potential drug interactions with Robitussin cough sore throat 325 mg, 10 mg/10 ml oral liquid antitussives. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Certain MAO inhibitors should be avoided while taking this medication, and it's important to check the labels of all your medications to avoid taking more than one product with the same ingredients. Be cautious if you are taking other products that cause drowsiness, and be sure to inform your doctor or pharmacist. Additionally, this medication may interfere with certain urine lab tests, so it's important to inform lab personnel and your doctors if you are using this drug. In case of overdose and experiencing serious symptoms such as passing out or trouble breathing, it is important to seek medical help immediately. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, dark urine, fast heartbeat, nervousness, abnormal/extreme feelings of well-being, euphoria, hallucinations, problems walking, staggering, agitation, and severe drowsiness. If you are in the U.S., you can call your local poison control center at 1-800-222-1222. If you are in Canada, you can call a provincial poison control center. Make sure to keep all of your medical and lab appointments. This will help ensure that you are properly monitored while taking Robitussin cough sore throat oral liquid antitussive. It's important to follow up with your healthcare provider to make sure the medication is working effectively for you. If you are using this medication regularly and miss a dose, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and take your next dose at the regular time. Do not double the dose to catch up. Make sure to check the storage information on the package and keep Robitussin cough sore throat 325 mg, 10 mg/10 ml oral liquid antitussives away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. Remember not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.